Clinical vignette. Increased preload, decreased afterload. A 45-year-old male construction worker presents to the clinic with complaints of a persistent, throbbing sensation in his right lower leg. He mentions that he sustained a deep puncture wound to his calf 6 months ago while working on a construction site, but the wound has since healed. Over the past few months, he has noticed that the area feels warm and swollen. He also reports mild fatigue and occasional dizziness. On physical examination, the right lower leg appears warm, with a palpable thrill and a continuous murmur over the affected area. His blood pressure is 120/70 mmHg, and his resting heart rate is 98 BPM. Echocardiography reveals an increased stroke volume and cardiac output, with decreased systemic vascular resistance. Doppler ultrasound confirms the presence of an arteriovenous AV fistula in the right popliteal region. Question: which of the following hemodynamic changes is most likely to be seen in this patient? A. Increased preload, decreased afterload, increased cardiac output. B. Increased preload, increased afterload, decreased cardiac output. C. Decreased preload, increased afterload, decreased cardiac output. D. Decreased preload, decreased afterload, decreased cardiac output. A. Increased preload, decreased afterload, increased cardiac output. Explanation: an arteriovenous fistula causes blood to bypass the capillary beds, creating a low-resistance circuit that reduces afterload. The shunting of blood from arteries directly to veins increases venous return, preload, which raises cardiac output due to the Frank-Starling mechanism. The decrease in systemic vascular resistance reduces afterload, making it easier for the heart to eject blood, leading to high-output cardiac failure if left untreated. Why not the other options? B. Increased preload, increased afterload, decreased cardiac output. Incorrect. AV fistulas reduce afterload rather than increasing it. C. Decreased preload, increased afterload, decreased cardiac output. Incorrect. AV fistulas increase preload and cardiac output while decreasing afterload. D. Decreased preload, decreased afterload, decreased cardiac output. Incorrect. AV fistulas increase preload and cardiac output, not decrease them. Would you like a diagram to accompany this explanation?